I thought we'd start by talking about what is the role of the ER tech. The actual role of the ER tech encompasses many different responsibilities and tasks. And some of the tasks vary by where you work. So if you worked in Harborview Emergency Room, it would be different than working in Swedish Admin's emergency room. The reason for this is if you work in Harborview's emergency room, you have a lot of residents and fellows, mostly residents, medical students who are learning to do things. And so the ER techs don't necessarily get to perform as many of the tasks that they're trained to do. For example, a big role of the ER tech at a community hospital or local hospital that doesn't have residents is splinting. Well, if you work at the U or Harborview, they have a lot of residents there, and the residents, the orthopedic residents, need to practice splinting because they want to learn how to splint. They need to know how to splint. So they're going to be actually doing some of the splinting, which will take the ER tech out of that role. But no matter where you work, vital signs are going to be right up your alley. Doing orthostatic blood pressures, which we'll talk about in detail, and actually have a practicum in the lab devoted to that. Wound care, and wound care can be the dressing part of it, irrigating a wound, changing dressings, doing EKGs, crutches. When a patient gets sent home on crutches, the ER tech decides which size crutch to give and actually educates the patient on the use of the crutch. Cleaning rooms. Uh, Housekeeping does not clean rooms in the emergency room unless, the floor needs to be done. Of course, they do that, but the turnover is fast, meaning that the rooms need to be cleaned quickly. So the ER techs know when the patient left and go right in and clean it and get it ready for the next patient. Stocking and ordering supplies, probably one of the most important things they do, because nursing, the physicians all depend on supplies being where they're supposed to be and having access to them when they need them. So usually one or two ER techs are assigned the responsibility of doing the ordering, and then everyone is responsible for stocking at the beginning of their shift, or if they use a lot of supplies, certain supplies during the shift. Most ERs have carts, and there's a pediatric cart, there's a wound care cart, there's a dressing irrigation cart, there's a dressing change cart, there's suturing carts. So lots of supplies to keep track of, along with the IV fluids and the IV tubes and everything else. Suturing carts need to be restocked regularly. So lots of busy task things, along with taking care of the patients that are there, transporting the patients to and from various departments, tests, etc., or if they're admitted to the room they're going to be admitted to. So the staff in the ER depends greatly on the emergency room tech to keep things going. Of course, a big thing that the ER techs do is they do chest compressions during a code. So make sure that you're up to date on your CPR, because you will be the person who is doing the chest compressions.